Hello, guys. This is Dr. Frank Jeffries from Jeffries Chiropractic up here in Marquette, Michigan. And I am going to make a series of videos here on YouTube. If I can figure out all the innuendos of working out this YouTube channel and doing it and getting it to you guys. And we're going to talk specifically about one therapy which is remarkable and will help thousands and thousands and thousands, millions of people who have back pain because they're not getting diagnosed. There's basically a blockade in this country to diagnose people with short legs and used heel lifts. Okay, that's the answer right there. Okay, but the problem is there's no doctors that want to do this because all the medical doctors would lose all their multiple surgeries. They lose billions and billions and billions of dollars. The insurance companies would lose billions and billions and billions of surgeries. And then, okay, they don't care about the suffering of any of you people. They don't really give a damn about that. They do not care. They absolutely do not care. Even the chiropractic profession, Palmer College, they speak very, very, very little about diagnosing true short legs, functional or anatomical short legs, and treating those with heel lifts. Very, 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 very little. So therefore, the DCs, they all come out and they all think they know what they're talking about because they had the training, blah, blah, blah. And they don't know jack about this. And they unfortunately, they think they do, but most of them don't. Now there is one method called the Gonstead method that did quite a good job of educating the DCs about this, but it's a small little sliver, and a lot of the DCs aren't into that technique, so they never learned it. So what we have is millions and millions and millions of people walking around with functional or anatomical short legs that are not getting treated, and they won't get treated. They'll never get treated by a medical doctor, almost never, like maybe one in a 10,000 or something. After it gets really bad, after people have lived with it for years and years and years, they might pick it up. But they really rarely do not do that. So what this channel is my plan is to get out a series of YouTube videos on this new channel. If I can figure out all the technical problems of the channel itself, to get the stuff beyond all the bullshit that's out there in the online. How do you get through the wrappers and all this other stuff? The garbage. So, but I think I could probably do it. So I'm going to work on that, and I will talk more about this. But this is this is basically treating back pain, okay? Because I've been doing this for 29 years. But it also prevents all these other things: shoulder surgeries, neck surgeries, disc surgeries, low back surgeries, spurs, hip replacements, all kinds of things. It's just, it's amazing. So what we have to do is we're going to go through the science behind it as in the future. But for now, Dr. Frank Jeffries, this is my main healthcare channel. I'm going to try to make it that way. Don't get mixed up between my other music websites, because I have two other music websites where I push out some of the songs that I write, and that's just my recreation. But this channel is going to be exclusively for getting the information out there for people who are struggling. And obviously, heel lifts and treating short legs is not the answer to everything in your life. If you have mental problems, you've got emotional problems, you've got all these other things, you've got problems, relationship problems. These are completely different. So please put it into context. Just like anything, any medical procedure, it has to always be in context. What's the surrounding environment telling you about the efficacy of any therapeutic procedure? How we could go on and on for a lot of things, a long time on that. Okay, so I'm gonna broadcast this one, and then I'm gonna see if I can work this out, and we'll go from there, and then I'll carry on with the next video, and then hopefully I'll be getting some decent response from some people, because it's basically pretty simple how this works. All you need is a good DC, doctor of chiropractic, DC. We all know what MD means, right? Because that's been brainwashed into our brains since we were in the womb, right? But the DCs, doctor of chiropractors, are the guys that you go to, and then you can guide them through it, through using my videos if you have to, because they basically aren't trained in this. They basically are not. It's just such a small amount of training. The schools just ignore it because the chiropractic profession would lose the millions and millions and millions and millions of dollars too by using heel lifts. By simply using heel lifts. It's like the cold plunge. Millions and millions and millions and millions of dollars. Wim Hof has prevented people just going in and jumping in cold water. Well, there's no industry in that. Who the hell wants to hear about that, okay? All right, guys, that's it. Dr. Frank Jeffries will talk to you again soon. See you around. Bye.